Hi, my name is Dr. Dilsher Dhoot. I practice here in Bakersfield, California. I've been treating patients with diabetic macular edema for 7 years now. Isam is a diabetic. Isam had been treated by us for 3 years prior to receiving the ILUVIEN. He received multiple treatments, actually on average a treatment every 2.1 months. Prior to that, he definitely had fluctuations in his vision, fluctuations in his OCT, and certainly expressed frustration to us about having to be treated so frequently. And also, we were frustrated given that we were always looking for forward progress and we were not seeing that with Isam. After being treated with ILUVIEN, he's done quite well actually. We treated him in September of 2015, and he has not received any further treatments up until today. The best way to summarize the outcomes prior to ILUVIEN and then after the ILUVIEN are to look really at the visual acuity and then the anatomic outcome. But certainly his vision seemed to fluctuate between 20/80 and 20/100. With that, he had persistent fluid on anti-VEGF and then certainly improvements in fluid on dexamethasone, but again, fluctuations in OCT. The fluctuations were seen. He was receiving a treatment once every 2.1 months on average prior to the ILUVIEN. After receiving the ILUVIEN, we saw that very quickly, actually, within about a month of his treatment, the OCT had a dramatic response. And then we saw that was sustained through the course of 3 years. Now, here today, he comes back at his 3rd anniversary of his ILUVIEN, and we're starting to see a little bit more fluid creeping in, non-central though. So he's had a very nice response overall. His pressure is being maintained as well. In terms of his visual acuity, when we first met in 2012, his visual acuity was 2100. It fluctuated as good as 2060 prior to the ILUVIEN. After the ILUVIEN, his vision has been maintained between 2050 and 2060. And so he's been quite pleased with his visual acuity response. In terms of his OCT thickness, we've seen that there were definitely fluctuations. There was, he would go from states of relatively thick as 600 plus microns to relatively thin as 240 microns, post dexamethasone. Prior to ILUVIEN, we saw many fluctuations, and we were able to actually stabilize that fluctuation in OCT thickness with the ILUVIEN back in September of 2015. Now, 3 years later, we're starting to see some fluid recur, and each time it's just a little bit more. And so I started the discussion with him regarding a second ILUVIEN because of that. Getting ahead of this rather than chasing this is probably the best strategy, and Isam agrees with that. So today we're recommending a second ILUVIEN for Isam. He received his first ILUVIEN back in September of 2015. That was 3 years ago, and actually he's done really fantastic on it. He hasn't required any further treatments for this entire 3-year period. And recall, he had received a treatment every 2 months before he received the ILUVIEN. Now we're starting to see some fluid creep back in, and each time it's been a little bit more over the last 3 or 4 months. And so now we know from the FAME-A, FAME-B data that this drug can last about 3 years, and that's what we saw. We've talked about our treatment options, and Isam and I both agreed to do a second ILUVIEN just because we know that the first one worked. Having another period of hopefully 3 years without having any further injections is very appealing to Isam. He recalls those days when he was receiving treatments once every couple months. Isam's been really excited about his successful course following the ILUVIEN. He hasn't required any further injections, and it's been 3 years since we gave him the first one. And so for him, it's been a real game changer. In fact, we've actually injected his fellow eye subsequently, and he's been quite pleased there too. At the max now, we see him about once every 3 months, just to monitor intraocular pressure and keep an eye on him. And so it's reduced the number of times he has to come into the office, and so he's quite pleased with the results. So Isam was actually one of the first patients that I injected with ILUVIEN. We've managed to keep his visual acuity sustained over the last 3 years. His fluctuations in OCT have been sustained, and he hasn't required any further treatments. And so I think that Isam is really a fantastic case for ILUVIEN, and that's really why it's a special case for me. I would say just overall that, I'm a steroid guy. I think that if you treat enough diabetics and you're only using anti-VEGF, you're really probably leaving vision on the table. I mean, I'm always looking for forward progress, and if we're not making forward progress, I'm quickly going to steroids. And a lot of times we're doing combination therapy. We're doing steroids and anti-VEGF, but the goal is ultimately to keep moving forward toward a dry retinal state. And sometimes you can get visual acuity back with that, sometimes you can't. I would say that ILUVIEN's been fantastic simply because in many patients you can have this steady microdosing, and then you can really eliminate the need for treatments, and for patients that's fantastic. But there are patients that require combination therapy and boosters of sorts with anti-VEGF or even additional steroid. You really just have to practice the art of medicine and tailor it to the specific patient, and that's typically how I practice.
Indication: ILUVIEN, fluocinolone acetonide intravitreal implant, 0.19 milligrams, is indicated for the treatment of diabetic macular edema, DME, in patients who have been previously treated with a course of corticosteroids and did not have a clinically significant rise in intraocular pressure. Contraindications: ILUVIEN is contraindicated in patients with active or suspected ocular or periocular infections, including most viral diseases of the cornea and conjunctiva, including active epithelial herpes simplex keratitis, dendritic keratitis, vaccinia, varicella, mycobacterial infections, and fungal diseases. ILUVIEN is contraindicated in patients with glaucoma who have cup-to-disc ratios of greater than 0.8. ILUVIEN is contraindicated in patients with known hypersensitivity to any components of this product. Warnings and precautions: intravitreal injections, including those with ILUVIEN, have been associated with endophthalmitis, eye inflammation, increased intraocular pressure, and retinal detachments. Patients should be monitored following the intravitreal injection. Use of corticosteroids, including ILUVIEN, may produce posterior subcapsular cataracts, increased intraocular pressure, and glaucoma. Use of corticosteroids may enhance the establishment of secondary ocular infections due to bacteria, fungi, or viruses. Corticosteroids are not recommended to be used in patients with a history of ocular herpes simplex because of the potential for reactivation of the viral infection. Patients in whom the posterior capsule of the lens is absent or has a tear are at risk of implant migration into the anterior chamber. Adverse reactions: in controlled studies, the most common adverse reactions reported were cataract development, ILUVIEN 82%, sham 50%, and intraocular pressure elevation of greater than or equal to 10 millimeters of mercury, ILUVIEN 34%, sham 10%.